Welcome back to the Stepped Up Nurse podcast. I'm really excited to have you on the call. I am Adeswa Oni, the Stepped Up Nurse, and today I have with me an amazing personality that's going to be speaking with us. It's going to be a beautiful time. She'll be sharing her experience as a fertility and conception coach. Wow, when I got to know her, is it up to a year that I got to know you? I think it's up to a year. It's up to a year. Yes. When I got to know her, I was like, why are you interested in such a niche? But today we are going to be hearing from her, and I believe that you'll be really excited. Please, if you are watching me today and you have not subscribed to this YouTube channel, please do well to subscribe. Also, do well to share this video with your friends so that they will be a part of this. Also, tell your friends that they should not just watch, they should put on their notification bell so that when next we drop any other video, they will be notified. You too do the same, please. Okay, so follow me as I introduce my speaker for today. Today I have Nurse Mary Alabi with us, and she'll be sharing with us. Nurse Mary, is really excited to have you. Kindly introduce yourself.
Thank you very much, the Step Up Nurse, for having me. I'm very, very grateful for this opportunity.
Hello, Nurse Mary, can you hear me?
Yes, I can hear you, ma. Can you hear me right now, ma? Thank you very much.
Yeah.
I'm grateful for having me. Okay, thank you very much.
Yes, I can hear
I'm
you.
Mary Alabi by name. I'm a conception and fertility coach.
You're welcome.
Thank you very much. And we started out, this is our brand, majorly since 2018. And I thank God for the grace and the opportunity of proceeding to this moment. I also thank God because this brand became more established by meeting the Cornerstone, the Stepped Up, no, sorry for that. That was last year when I picked up personal branding course with her. And so after having the course, I was able to expand the brand, helping women to achieve their dream of having a baby or babies. And I've had a lot of success stories by the grace of God. The first success story I had was in 2018. I met with
Okay, wait, Nurse Alabi, wait. Let's rewind a little bit. So now you talked about moving on into the Cornerstone brand, right, and helping people with their conception.
I came into nursing profession since 2009, and then I had the desire to be an health practitioner. Not only that, I wish to help humanity, to help people to come out of their health challenges.
Okay.
But I had to start from somewhere, so I went into nursing school in 2019. I did my post-basic nursing in 2014. So also I went for public health nursing in 2016 and graduated in 2018. And not only that, I went for BNSC at Obafemi Awolowo University and graduated in 2022. So since then
Okay, wait, no, Alabi, wait. Okay, are you trying to say that you took a very, very long distance, actually?
No, I started with midwifery. I started
and then you did your midwifery
basic midwifery training.
Right? Is that correct?
That was in 2019. So after then, I went for basic nursing in 2013.
Okay.
So
Okay, now I can see where the deep passion came from. You did midwifery for 3 solid years. I've actually discovered that there are some people that have a deeper passion for pregnant women. And when I traced back their background, they started out with midwifery first before they came into nursing. So that streak for pregnant women was actually stronger in them. And I actually didn't even know this about you before now.
Thank
And
you.
I'm really amazed at how much work you are doing to help people get pregnant and have their children. So you mean because of career progression was why you decided to go all through that route? That means you've been in school for the past how
2020,
many
but
years
because
now?
of
For the past 15 years.
so
Am I
coronavirus
correct?
outbreak then.
When did you finish your PhD program?
So the Senate released that report in 2022.
Okay.
No, we've concluded our exam in 2020.
The COVID
But because of
outbreak,
I think there was a
cut your
challenge
course
then,
in between,
so
right?
the school
It
refused to release their results until 2022.
Okay.
That was when the results. But we were actually done since.
Oh, okay. That's okay. That's really amazing. Okay, I'll be really excited to see you become a professor in O&G or in maternal and child health
No.
or in midwifery. It means that you are going to be reading for the next 30 years of your life. Or okay, it's not that far now. You just do your masters and do your PhD. 4 years, 5 years, you are done. It's not going to be a long time like that. Okay, share with us.
The journey has really been interesting. In fact, God has been making ways for me since I started. Because when we started in 2018, when I had my first client, in fact, I didn't really plan it, but she came to me and discovered that she's having secondary infertility. She delivered, she got pregnant for the first pregnancy. She had no problem getting pregnant, but since after that she couldn't get pregnant again. She has gone to federal medical centers, gone to specialists. She has spent good 8 years and without success. So I have to
okay, sorry. You mean that our first child came naturally in good time?
Yes, ma'am. You are very right.
Secondary fertility, right?
So
then
when I discussed with her, I discovered that she had an infection, and I know that was the major of that delay. So we had to treat her and the husband. And after the treatment, although I explained to her that truly I don't make children, but after guided, if you go through my guidance with the help of God, you will get pregnant. So that same year, she got pregnant and she delivered a baby after 9 months, to the glory of God.
Wow. That's really amazing. So throughout that period, when she got pregnant,
I told her that after making the treatment,
when she got
I gave her some supplements that she will be taking, both for her and the husband. And that I went with her. Whenever she's having a menstruation, I do help her to check it. And even I told her that she had to stop some activities when it is 5 days to her menses. So because I discovered that most women get pregnant every month, but they lose a bit also to stress and all other factors. So I had to follow her up whenever she's about to see her menses. So, and I used to tell her those activities she will be avoiding, those things she will be doing, everything. And to the glory of God, after 5 days of not seeing menses, I told her she should go and test for pregnancy. And she told me it was positive. Although it wasn't the first month, it was not the second month. I think it took about 5 or 6 months. But eventually, God, wow.
Okay.
Yes, I thought that it was a non.
So
Yes, I
for
told that
that
not only
5 months,
supplement,
all
I
through
told
she
her
was
some,
using the
I also
supplements,
added some
right?
diets that will assist her
She
in
and her
the journey
husband
of
every
into
day.
conception. So they were hit, both her and husband were taking the food together along with the supplement, and also we
Okay.
followed up
Okay.
menses to ensure pregnancy.
Okay. So I wanted to ask, what was it that you were actually monitoring in that patient? Was it the time her menses comes, abi the time her ovulation is about to come? Which one was it that you usually
And I was I was monitoring both. I monitored both
okay.
because before you can talk about fertilization, you have to ensure that you follow up the ovulation period. So I used to help them to have like 3 months. I
Plan.
will check on how they ovulate for the first 3 months.
Okay.
So I will make an average value of their ovulation dates.
Mm-hmm.
So we try to target that ovulation day, 2 days before ovulation and 2 days after ovulation.
Okay.
So I will ensure they meet with their partner. So when that is ensured, so now next point we are going to follow up is that menstruation, to ensure that menstruation does not
So
come,
you say you ensure
because
they
most
meet
of
with their
them
partner. What so you, when those days come, the 2 days before and the 2 days after, you start monitoring them, but make sure you climb your wife, oh.
no, yeah, no, not that I will go to their
You will
houses. I will ensure they are looking for
eh.
children, so I should not beg them to see the. I should not beg them. Even though if they are the type that used to, they maybe they love to have sex or
eh.
not, this period is a must. Is a must do. So I used to tell them is a must do. Between these around 4 to 5
eh.
days, you have to
So
see
what if they
yourself.
are busy and
Yes.
maybe the wife
To
is a banker and the husband too is a, maybe is a pilot, and they are hardly at home?
and in as much they are interested in fertility, in conception,
Yeah.
they must look for time. They must, even this period, especially, I used to tell
Mm.
them a woman can only get pregnant only this fertile
Mm.
period. If you miss that 4 days or 5 days, you can never get pregnant. So you just keep wasting your time.
Mm.
And some people has a fertility issue, not that they really have problem, but some of them are ignorant of
Yeah.
this fact of
Yeah, and those
uh,
days will pass and they
the
will not do anything and they will not get pregnant for years like that. Mm.
yes, another thing is positioning.
Is what?
Another thing is positioning, because
Okay.
some
Mm.
positioning
Mm.
sexual act,
Mm.
positioning matters,
Mm.
because some they'll say after they have the meeting themselves, when they stand up they'll see the sperm outside. So I usually I used to inform them that whenever it is time, when you are done, you must not stand up until it is day.
Mm.
So until you anything you want to do before that period, ensure you do, so that whenever you are done and you have to lie down,
Mm.
so you lie down in a lying down like normal
Supine position.
position. So you have to lie
Do
supine
you tell them
position.
to elevate
So you
their
have to
bum bum?
ensure that no, if there's no need for elevation of bum bum, just be yourself. The totomy position, that's the position. So when you put your back on the
And
bed
their
and
feet up.
anyhow, your back and their feet off.
Okay.
So after that, ensure you don't stand up until it is day,
Okay, so what if the
except
position
maybe
in which the penetration happened was not anything related to missionary? Will the woman now adjust her body and decide to lie down?
no, it's a must. If you are going to sign up with me and you are interested in conception, in fact having a child, you must adopt that position. For that, you may use another position at another
Eh,
time. But this
eh.
period where we are having so you have to adhere to that position so that you be able to record success. Because other positions may not, it may work and it may not work.
Okay.
So but that
Missionary.
missionary position is
It
yes.
usually works.
So
So
you have
that's
to
why
maintain.
you see people, like, there are some people that they get pregnant every month. as a baby is coming out and that baby is
Yeah.
coming, because at least missionary position is like the commonest. It's like the easiest for people to adopt,
Yeah.
and the one that many people know about. And those many people we are talking about,
Yes.
they just keep getting pregnant like that without even thinking about it. As in, before her back is on the
Yes.
ground, she's pregnant already. So there's something I usually hear. I don't know if that thing is correct. Some poor people, like poor
Okay,
people
ma.
in quotes, they will say, God gave us children, God gave you people money. When they are talking to rich people, they will say, God gave rich people money, God gave us children. Does that make sense? Does it follow? Have you seen it? Have you seen the statistics? Does it always follow in that manner, that maybe God looks at some people and say, this one, so don't worry, I'll give you people children, and this one, so you people will have money but you have only one child, that kind of thing?
No. Then God give whosoever that desires a child. God will give the person, that rich or poor. But the major factor why we consider that poor people have more children is that, one, they have more time to spend together. They have lesser.
It's true.
So before, unlike the rich people, they will have like 4 5 businesses. Sometimes even at night they will be traveling from one town to the other, so they really have more time for their wives. So that's why you see they don't have much time with their wives. So the little time they have, and it may even be the time that the woman is not even
Ovulating.
fertile. So most times she may not be ovulating during the period they will see. So it will just be like they're looking for children, and most of them, they don't realize that on time. So that's what I think really occurred in that
Have you had
scenario.
people that had to go for IVFs before, that you recommended IVFs for and it was successful?
I think currently I have like 2 of them,
Okay.
but we are still, because I have discovered that their egg reserve was very, very low.
Okay.
ARM, anti-mullerian hormone test, was done, and it was like very small amount that is remaining, and shows that they have little or no egg. In that condition, if you tell them to keep taking drugs, taking supplements, it may not work. It will not. So in such a case, I will encourage them to go for IVF. So I have like 2 of them now. Like she traveled, she told me when she is back, we'll discuss better on that. And the other person too, I think the husband they're thinking because of financial issue. That's what is still preventing her from proceeding. So I've even had to there's a consultant we have in gynecology who is experienced in IVF. I've taken her there, but I think because of finance, she has not been able to proceed.
Okay.
So I've even thought of it that
what's like the least amount
soon I'll start
somebody needs
reaching
for IVF? Like in your part of Nigeria,
at
the
the
part
least
of the
amount.
world where you stay, what's like the least amount somebody needs for an IVF? Like for the procedure, the procedure itself, and what the person has to spend even after the IVF.
You need like 2 million.
2 million where you are, right?
Like 2 million, 1.5. Yes, 1.5 for the procedure, and like the other 500,000 for all other expenses. Either foreseen or expenses. So if you have like 1.5 to 2 million, you can do it.
Is the success rate
Because
good?
actually,
Are there people that you've seen that tried it 2, 3, 4 times and it failed?
yes, now it is 50-50. Even you'll be informed before starting the procedure that this procedure you're going through, it is 50-50. So it may work and it may not work. I've seen a woman who is over 50 years old who went for the first one. It was successful. The second one, it was successful. It also was successful. Now she had 3 children, because the first was twin, the other one was just one. So she has 3 children. I've seen that person who is also over for 55 years old who had a failure record. It failed. So
that person that was 50 now, if she knew about this intervention earlier, maybe at 35 or at 37 or 40, it would have helped her to take action on time even before the age 50.
Yes,
Do you create awareness around IVF,
yes.
or do you avoid the discussion so that it will not spoil, it will not reduce their faith? You know, maybe you are trying to encourage people to,
Yes.
okay, talk to God about their situation. If you now bring up IVF, do you feel that it will make people have less faith in God?
No, what I do is that I don't tell everybody about the IVF. I tell those people that I think they really need it,
Mm,
especially people that are over 40. Those people that have done a test that is, I discovered that they have little or no egg
mm,
in reserve. So I will tell them, I will have to let them know that even though, even the IVF, it is only God that can make it to be successful. So you doing IVF does not mean you don't believe in
God,
God. It is that God that will make the IVF work.
successful.
So I always encourage. Yes, yes. So I always inform them that, especially people that are over 40 years or 50,
Mm,
if I think, if I will ask them to carry out a test that is called anti-Mullerian hormone test, so to know the egg reserve that she's having. If she's having little or no egg reserve, the next thing is for you to go for IVF. So she just not just keep deceiving
mm,
herself. Faith in God does not mean, when you have faith in, even anything you are doing, if you don't involve God, it will not be successful.
mm-hmm.
So you doing IVF does not mean you have faith in God. It is that God that will even make it to work. Because I used to tell them in my brand that I don't make children.
Mm.
We do our part. We will not rely on God, make our prayers and do all of that. Rely on God to make it successful. So God is the number one factor in any method you might want to use, that IVF, either natural conception like that. God is number one
Now,
factor
talking about this
in
God
it.
factor, are there people that you have seen that their only solution is IVF, but you know that they are very poor, like they not get that money, they never even chop belle full? What would you do for such kind of persons?
Those kind of people, I have had it in mind. I'm having it in mind that very soon I'll start reaching out for
Mm.
sponsors. That on social media, on LinkedIn, on Facebook. Like I know, I even have one currently.
Mm.
She just got married like last year. She's now 43 years old,
Mm.
and they are managing it. So even currently, there's a challenge that we're doing in our
Mm.
community on a
Mm.
supplement. So to just assist their conception. But this kind of people, they cannot afford
Mm.
it. So I'm having it in mind that soon I'll start reaching out to people, soliciting for help for this kind of group of people, so that they will be able to have the joy of motherhood.
Mm.
Because there's not, their family members cannot help
Mm.
them. Because there was a time I discussed, I have to even discuss it with your family members. They know, but they cannot assist, and they can't
Mm.
afford it. They're already on loan.
Mm.
There's no how they can even get the money for IVF. I know that the only solution to their problem is to have some sponsors.
Okay,
So
apart
that's
from
what I'm thinking
sponsors,
of.
which is
How
human
we
solution, is there any spiritual solution that you provide to patients, that maybe, okay, maybe you know that, I know that God can do all things. You know, some people tell you, okay, doctor, this is what we feel, auntie nurse, this is what we feel, and I know that God will answer my prayer. Is there any support you give spiritually to people that you know that they don't have money, they don't have sponsors, but it's just God they have?
I'll just pray with them.
Hmm.
I pray with them too. So after praying with them, if there's anything I can do, I can assist. I'll just encourage them to just follow up with their eating habits, the kind of food they should be taking, and the supplements too.
Hmm.
The supplements that they should be taking, I will encourage them to continue, so that at least, even though if they are not getting pregnant now, the body will not be winning, it will not be reducing. The functionality of their reproductive system will not be decreasing. So I will encourage them to continue with their supplement and to
Hmm.
eat well,
Oh,
so that at least keep their reproductive system going on well till when God will do it, or when there will be a sponsor, or when there will be, for the other next action will be
hmm.
taken.
Okay, there's this book, Supernatural Childbirth, that people use, that I've encouraged people to use before in my community, people that are looking up to God. have you come across the book, or have you recommended it to somebody before? Have you seen somebody that told you that, oh, this book helped me? And the examples in that book, is it one that you have shared with somebody before to help the person's faith?
Yes, I've read about this supernatural book. I've not read it.
Okay.
That I read it. It was given to me by one of my family friend when I initially got
Okay.
married and I was having issues with
Mm.
getting pregnant. I was getting pregnant but losing
Mm.
it. I had the challenge of like a personal challenge. Whenever it's my getting to my menstruation period, I would start
Mm.
palpitating. I would start thinking like I want to see blood,
Mm.
I think that was major, but one reason why why I went out
Mm.
to help all other
Mm.
women
Mm.
in issues.
Mm.
So that woman gave me that supernatural childbirth
Book.
book, the one you just
Mm.
talked about. I read it, and I think it majorly talked about having faith in
Mm.
God, believing
Mm.
God, making decree of what you
Mm.
want. Even after having the children, after having the babies, it encourage women to have a positive words
Yes,
for their children,
yes.
declare positive,
Bible
positive,
confessions for
God,
pregnancy
yes,
and for conception. Yes.
yes, yes,
Yes, okay.
yes,
Okay,
ma.
that's really nice. Have you been
Yeah.
able to record success stories since you started actively? Are there people that when they came to you, they had no hope, and then finally they had their children, and then how did their story progress? Was it a tough one for them to finally get pregnant? Was it stressful on you? As in the process, was it stressful on you, or was it very smooth?
Oh, by the grace of God, we've had a lot of success
Mm.
stories. Like, aside the one I discussed
Mm.
earlier, we also had another one. That one was I met the woman when I was doing my mandatory compulsory midwifery
Okay.
service. So then I happened to be the one to even I preached to her then, and she gave her life to
Oh
Christ.
wow.
But later, maybe after a year, she got married.
Mm.
It was when I think around after 5 years or thereabout, after when I got married and gave birth, people from that community came to visit me at home, and I asked about the
Woman.
woman that how about so
Okay.
person that she had not given birth. They told me that she's yet to give birth since she got
Mm.
married. It was now
Mm.
7 years of primary infertility. So I encouraged that. I took her number, I called her, I told her if she can come with her
Mm.
husband, we can discuss it and look at the problem and look for ways we can solve the
Mm.
problem. And she came with her
Mm.
husband, and I also discovered she had an infection. It was treated, both she and her
Mm.
husband, and we started on the supplement and the food she should be taking. They took it. In fact, she already had chronic hypertension because of this
Mm.
issue, and she's like a 26 or 28 years
Wow.
woman. So she was thinking because of that challenge. So we had to manage both
Mm.
hypertension and face conception issue
Wow.
too. So eventually God did it. She got pregnant, although she delivered around 7 months because of
Mm.
pre-eclampsia.
Yeah,
But thank
preeclampsia.
God the baby lived and that's
Mm.
fine. So recently, this year, I think this month, was it this month or last month, I recorded another story. There are a lot of stories
That's
I didn't
beautiful.
even discuss. But there's a major one that God did, I think last month or this month. I met her during the course of this creating a community for the people waiting on
Mm.
God. So she signed up for my one-on-one appointment.
Mm.
So because we have two phases, we have the first phase on appointment booking. You have to book for an appointment. Then the second one on infertility treatment, and the third part on following up bumper to bumper and conception. So she came up, and I discovered she had an follicular ovulation, that is no
Mm.
egg when she
Wow.
whenever she whenever it is a ovulation period. But I have to, I gave her some supplements. I also encourage her on some certain diet she will be taking. So God be the glory. She told me this month that she misses her period and she tested positive.
Wow.
So even that of her husband was not even enough, but God just did the did the wonder. I was so happy. I had another client, international client. I think she's in UK. She's in US.
Oh,
No, sorry, Canada. So she also signed up for my one-on-one
that's
appointment.
nice.
She also told me
No,
this
Alabi, you're not sharing your
pregnant.
testimonies with me. Oh, I will collect my personal branding course back. I'll collect it back from you. You're supposed to blow the whole internet with these testimonies. Hey, this is really amazing.
Yes, yes, yeah. God really used you for me, and I bless the name of God for meeting you. That was why each time whenever I come across maybe your posting, your discussion, and I want to share it, I want to share it with you. I
Hmm.
want to, in fact, I know God, you are going to places. So God really used you for me, and I pray God will keep expanding you, multiplying
Please,
you,
so share the story
making
with me.
you
Oh, let me
great.
share it with the world. Oh, that God is using my sister. Oh, if you need help, please reach out to her. Oh.
Yeah.
You know, a closed mouth is a closed destiny, and some people, you may be their solution, and they may not know. So this is why it's actually good to propagate this information, and you still reiterate to them that it is still God that will do it. It's not like immediately they reach out to you, they just get pregnant. It's still God that will do. But these testimonies will
No.
help to elevate their faith and make them feel, yes, okay, this thing is possible. My own case is not going to be an exception. Thank you so much, Nurse Mary Alabi, for sharing with us today. It's been an amazing time with you, and I believe that a lot of people that are looking up to God will find this video very insightful. They'll be able to believe God for solutions to their problems. Please, if you are watching this video, you can reach out to me. I'll give you a number so that you will join our community, and so that you can reach out to her also for a one-on-one session regarding fertility and conception, both you and your partner, right? So if you are watching this anywhere you are, please share this video with your friends. This might be their connection to what is divine and what they've been waiting for a long time. Thank you so much, Nurse Alabi, for sharing with us today. Thank you for connecting people to their bundles of joy, and I pray that your own joy will not cease in your own family. Thank you so much for having us. Thank you for coming on board to watch this video. Please, if you have not subscribed, do well to subscribe right away and put on the notification bell, so that when next we join any other, when next we drop any other video, you will be notified. Thank you so much. See you in the next video.